You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your privates, helping you get in the know down below.
All right, welcome everyone. Thank you so much for being on the In Your Pants podcast episode with me. Today we are talking about acupuncture, but particularly how acupuncture can be helpful for erectile dysfunction. And on the show to help me explain that is acupuncturist Danielle Bruner, who is the owner of Attunement Wellness. She's a licensed acupuncturist, certified also in neuroemotional technique, and she's licensed by the Oregon Medical Board. She graduated with a master's degree in acupuncture and oriental medicine from Oregon College of Oriental Medicine. Danielle has developed a very special and, in fact, revolutionary innovative treatment protocol for erectile dysfunction. In as little as 2 to 3 months, men experience a return of their natural energy, higher libido, and increase in erection quality and strength. Oh my gosh, not to mention probably all the other collateral benefits that we'll be talking about on our show. But this holistic treatment benefits men by avoiding the side effects of the little blue pill, which we'll be talking about, and not to mention the effects that it can have on their wallets. Yes, that pill is very expensive. So without further ado, let's get to it. Danielle, welcome to the show.
Thank you, Dr. Susie. I love your show, and I'm so grateful to be here today.
Awesome. So before we dive into the science and the ins and outs of how you work with your clients with ED using acupuncture, I'm curious, and I'm sure our listeners are curious, how did you get into working with men and erectile dysfunction?
Yeah, no, it's a good question. I get asked often. So while I was in grad school, I got invited to work with my teacher who's Chinese, and her specialty is fertility, so women's health. And in grad school, we particularly study gynecology. There's not a lot of men's health information out there. So if you know the female body and the male body, as you do, the points are the same. So the channels are the same, the energy meridians are the same. The human body is the human body. So I had a few patients come to me and they just mentioned, oh, I also have ED with along a string of other things. And so I thought, well, we could try this. And I did obviously get my books out and start reading up on some things and particularly about ED and just took it from there. And I was actually pleasantly surprised. I mean, the feedback I got was shocking.
Wow. And so what I'm hearing you say is that men actually were expressing their concerns to you about their issues down there, which is pretty hard for no pun intended. It's difficult for men to really come out to say that to a healthcare professional. I mean, I know healthcare professionals in general are not really asking about sexual questions, whether that's for a male or a female, but people are not always talking about it either. And so that's how awesome is that they had the courage to kind of say, hey, do you think you can help me with that down there?
Yeah. And actually it's on my intake. So that's kind of what starts the conversation. So if you are an acupuncturist listening, I'd say add it to your intake, especially also premature ejaculation. So when we go there, I don't really have any problem talking about that because we ask a lot of invasive questions as acupuncturists. We ask about your poo and we're asking about your urination, whatnot. So it all is connected.
That's awesome. Well, that's great. And what great advice for other practitioners out there. Just ask the questions.
Yep.
You don't know how you can change somebody's life by just asking them the right questions. So how does let's just kind of get the basics of how acupuncture works before we connect it to how the treatment might work for ED.
Sure. Yeah. So I came up with this in grad school and I thought it was kind of funny. And so I just stuck with it. But being from Portland, Oregon, we've got a lot of mountains and trees and rivers and whatnot here. So, and a lot of fishermen. So I would say to men, I give them this whole education the very first session. And that's why I spend a good 75 minutes with the patient. Mm-hmm. And I explain the energy meridians head to toe as if they were rivers. So think about, you've got these rivers flowing head to toe of what we call chi or life force energy or prana, whatever word you want to use. And over time, as we age, there's stagnation or there's chi deficiency. And so think of it as a dam in the river. It's blocked. And so what I'm doing with these tiny little hair-like needles is inserting them into the acupuncture point and stimulating the needle a certain way as we do. And it breaks the chi flow, or it actually can tonify and build the chi. And so essentially what we're doing is bring chi, that travels through body fluids and blood. We're bringing that all to the pelvis. which is very similar for fertility, like for women to make a baby, right? You need chi, you need blood to come to the pelvis.
Right, right. Oh, that's so awesome. So, and it sounds like you're through this process of connecting with that person, listening to their story, and then using a treatment protocol, based on thousands of years of Chinese medicine, but how that influences that person's nervous system,
Exactly.
like it's that we're all electrical beings and emitting electrical energy all the time. And so through what you do, you're essentially tapping into that person's nervous system, it sounds like, and like really helping them.
Yeah. And I also want to clarify something, because this question does come up a lot, is do we put needles in the nerve? Absolutely not. That's why that's why the education is 4 years, a master's degree. We are trained specifically on avoiding the nervous system. You do not want a needle in your nerve at all. So these energy meridians are actually traveling near the nervous system, but not in the nervous system, not on the nerves, right? So each point is particularly measured, and that is the training. It's hardcore training. So
totally.
yeah, so I would definitely make sure, if you're ever working with an acupuncturist, that they are licensed. Hopefully it is the law, and NCCAOM certified is another certification that is important.
Okay, so definitely get together with someone who is experienced and has the credentials and knows how to help you. Thank you for clarifying that. Thank you so much. Okay, and so you kind of were going to go into how it like helps with pelvic health, and you touched base on women's fertility and how it works with that, but it's similar to for male. How, in your experience with acupuncture, how is it really helping with ED? What are some of the changes? What are you stimulating to help that process?
Yeah, so I'll get into that, but first I also want to explain about how do you talk to a patient also. So for men out there, I'm not getting into the business of sex, right? So they do like to tell me their stories, and I usually stop them and say, okay, we're not here to talk about your sex life or what happened last night. And they also feel uncomfortable, right? So they don't really want to tell their whole story of what happened last night, and I didn't get an erection and this is what happened, and all that. It's not relevant to what's happening with the treatment. But what I want to know, this is how I developed it, was on a percentage, where are you today? And so that they're responsible for every week that they come in, because it is the protocol, it is a commitment weekly, because each acupuncture treatment works off the last treatment. And sometimes if we wait a few weeks before they come in, we have to start all over, right? So that's why I developed this whole 2 to 3 month protocol. And I asked them, okay, where are we today when we first start? And I start with 50%, being that you can get an erection and you can penetrate vaginally, but maybe you're not sustaining the erection. And that's usually a good measurement, right? And I've had people say 0%. I've had one guy that said in 7 years, he had 0% erection. Okay. And we'll get into that a little later too. But we start there, and then every week we're progressing. So that helps me determine, are the points working? Do I need to change things a little bit? And the diagnosis, by the way, for every acupuncturist out there, they should be taking your pulse and looking at your tongue. And the reason that we do that is I like to describe it as I'm painting a picture. So what does the tapestry, the art, look like in this person's body? And what I mean by that is, what is the chi like in Jerry's body? Let's just use a name out there. Okay. And we use words like, is it wiry? Is it slippery? Is it choppy? And that is a determining factor. And then also the tongue has all the organs pre-mapped out on the tongue. So I can see if that person's spleen is qi deficient. That's a term that we use in Chinese medicine. Or if there's liver qi stagnation, meaning that there's a block in the liver channel. And those will help me determine which points to use. And then I'm getting feedback from the patient. So when they're coming back every week, they can tell me how many morning erections are they getting? Has it increased? That's usually the first thing that happens after about treatment 3 or 4. Then they start having morning erections regularly. And maybe this guy hasn't had an erection in the morning for years. So that's a huge thing, right? Maybe their urination has changed. Maybe the dribbling has stopped, or the profuse, a lot at one time has stopped, or they're not getting up in the middle of the night to go to the bathroom. Those are all little incremental changes that gives me feedback. So we know we're on the right track. I just keep doing what we're doing. We may add herbs. I usually don't like to add herbs until about 3 or 4 treatments if they need herbs, because I want to see if the acupuncture is working. So there's a lot of information there. And then also I do what's called electrical stimulation, which is we connect the It's kind of like a TENS machine, and we connect the wires to the needles actually. So that gives a pulsation and helps break open that dam if we need to in the energy meridian. Okay, so I kind of went around your question, but if you
you did.
To
No, you're totally fine. No, you meant no, you totally answered the question about how acupuncture can help with essentially, ED. You went through the process, and then you went through how you kind of evaluate and reassess. And it sounds like it's a building of from the first session, the second session, and the third session. You're kind of working with that person's body and of course everything they bring to the table. But that's, you've totally answered that. So thank you so much for that. You mentioned, before we started recording, we were talking about testosterone.
Yeah.
And I'd like to get, your feedback on, okay, well, does acupuncture work for everyone? And what are some other contributing factors that might be coming into play when it comes to sexual dysfunction?
Yeah. Okay. So a lot of questions there. I'm going to try to stay on track with it. So I've been doing this for 5 years, and I just I recorded cases. And so that's why I use that measurement tool percentage. And what I found is I could count on one hand of people that it did not actually work for, that I was just stumped. Like, I don't know. And I'm not there. I make this very clear to my patients. I'm not there to take your money. Like, if it's not working, I'm not going to continue the treatment. Right. So I usually refer them to someone else. And typically I will refer them to our naturopath in our office for further evaluation. And what I want to see is testosterone. And typically when it doesn't work, testosterone is very low. And they haven't probably checked their testosterone in maybe ever or 20 years or something like that. Even young guys. So I do get a lot of late 20s, 30s. I'm starting to see more and more of that. And they've never had their testosterone checked. So yeah. It's not something typically that a medical doctor or an ND will do unless they're asked.
Right. Exactly. Right. And the reference ranges are just so broad that it's always usually just helpful to compare it to your own normal. Because we were also talking about like how someone could have, lower testosterone levels, but be completely fine, and have just fine sexual function of their penis, and others have very low or also have very high testosterone but have issues. So it's all about that whole, taking into consideration the individual and their symptoms and their lifestyle and everything to kind of paint that picture, as you said earlier.
Yeah. And also just to clarify, once they get their testosterone checked, and if it is too low and their doctors put them on some type of supplementation, we continue the treatments. And then of course it's fine. Everything works great. And so I just want to be clear that it isn't just like you said, it isn't just testosterone. We need to the penis is blood filled, right? When it's erect. So we need blood to get there. And if it's not moving in that area, as you know, working pelvic health, there's a lot of moving parts down there so that are really intricate. And we're just opening it up. So I think acupuncture and holistic pelvic care goes wonderful together. Like, I love that.
Yeah.
The marrying of them. Yeah.
Oh, absolutely. Yeah. And as you're saying, it's like everything is connected. And the more that person understands how everything is connected, it's less of an alarming thing. Because once bitten, twice shy, I always say, like, if it happens once, it's really easy for you to think like, oh my gosh, I'm going to worry. Is it going to happen again? Like, and again and again. And so you're constantly worried. And then now you're dealing with, the nervous system and the psychological aspects of erectile dysfunction. There's a psychogenic component. I find it hard to believe that there isn't a psychogenic component whenever that happens, because it is a change in a function of your body that you did not necessarily have voluntary control over. Exactly. And whenever that happens, it just freaks, you have the brakes on and you're like, what's going on? Is it not working? And so, yes, I think taking more of that, like, let's take a wider lens approach. Let's look at all the contributing factors to why this might be happening. And Danny, you mentioned this really great. You're like, it's not just testosterone, but it's everything else. What do what's your lifestyle like? Are you sedentary? Are you exercising? What's your diet like? A lot of these things can be very preventative. I don't want to say all the time, but it can be preventative if we start early.
Yeah, exactly. And it's funny because I do get a lot of men in their 60s and 70s even. and they care about their penis. They want it to work, which is always shocking. I'm like, okay, there's so many other things that are going on here, like diabetes. And I have had, I'll give you an instance, like, yeah, I had a guy that was basically, when he called, he said, do you have wheelchair access? And I said, yeah, you can come. It's just, one level. But he came in on these huge boots and a cane and could barely walk. And so we got him to 100%, which was amazing. And I also helped his diabetes. So he was he was walking without a cane and no boots by the end of the 12th treatment.
That's amazing.
Yeah.
Wow. I'm sure he owes you his life.
They're always great stories. I love it.
Yeah, no, totally. So on that, so we went from testosterone and other factors, but cycling. So we were talking also off the air about cycling and what are the ramifications of cycling, because you've experienced this as well in a recent case. Do you want to describe that case for us?
Yeah. So a chiropractor friend recommended I see this patient. So he called me up and he was explaining that he gets numb after triathlons and part of that cycling part. I'm not a triathlon. I'm not a cyclist. So I don't know that piece, and I don't have a penis. So I don't know about all of that, how that works. But so he says 2 weeks he's numb. This particular time he was numb for about 6 weeks. And so nothing was happening down there. And there is a point that sometimes we have to use. It's called conception vessel 1, and it's in the perineum. And on his first, I don't like to use that on the first treatment because it isn't, you have to explain it. And if they've never had acupuncture, especially, it's a little, like, what the heck, you're going to put a needle down there, which, by the way, we should talk about that. There is no needles in the genitals.
Thank you.
Oh my God. I forgot about that. Yeah. Most people do think about, there must be needles in my penis. No, nothing like that. There's no channels actually on the penis or vagina. So but going back to that case, it was 5 treatments and we did that point. And he told me that he felt like he was 15. He was 47 years old. And we didn't, after that, I said, go tell your friends and, tell your cyclist friends, right? Because as a female, we were telling everybody if something works.
Right.
And that was the one thing I was shocked about. Like, nobody refers because they're not talking about their own case.
No, they're not saying, hey, what's going on with your penis today?
Yeah.
How's it going, Bob? That's
right. Exactly.
That's a typical thing that happens. And we should normalize these things, as you're saying. Like, let's talk about it, because you don't know who else is experiencing the same thing, but perhaps living in isolation and fear, thinking they're the only ones dealing with this issue and they're going to have to live like that for the rest of their life. And prevention is great. I mean, we mentioned cycling. A triathlon, you're biking for miles. I mean, I don't know the exact number, but it's a triathlon, so I know it's a big deal. It's like a marathon. And yeah, it is common for cyclists to experience what we would call saddle paresthesia, or numbness or tingling to that area. And, there are nerves that travel underneath your sit bones and branch out and go to your penis, and they communicate with your spinal cord, and then that goes up to your brain. And so there's whole connection, but they have to run through tunnels, and they have to run through connective tissue and muscle and around bone. And sometimes they get cranky, when blood flow is altered to that area, or when there's no, a non-relaxing pelvic muscle issue happening, that could contribute to the overall cranky nerve syndrome. Thank you, Diane Jacobs, for that term. But anyway, cranky nerve syndrome. So that can happen, and it's totally treatable. The sooner that you address the issues happening down in the nether regions, the more successful you'll be with the treatment outcome. So
yeah. And I just want to also say that I heard about pelvic health through 2 male patients that told me that they do it. I mean, I knew that they do it for women, that you do it for women, but I had no idea that pelvic health existed for men and that they go in anally. I mean, I wasn't even putting it together, right? So I just commend you with what you do too. It's amazing work.
Mm-hmm. Oh, thank you. Thank you so much. We're stronger in numbers, right? It's just, how can we help the person in front of us? And sometimes the tools we have in our toolbox are not what that person needs. And so it's really helpful to have a network of wellness providers and a team to help support that person through their health journey. And I'm such an advocate of that. It's just like, an abundance. We're all in it together. Let's help this person. It's not my agenda, it's their agenda. And if I can't serve them in the way that I know how, then I should at least make an effort to reach out to someone who can. So
Yeah.
Anywho, but yeah, no, that's great. Yumminess. And one more thing about the cycling that I just wanted to mention for our fellas out there is that, there might be a correlation with, sexual dysfunction and pain, maybe, but not always. Not everyone who cycles has issues. It is an individualized case by case situation, and so making sure that the person you're working with is really taking that look and individualizing that treatment plan for you. So no, cycling is not bad. It's just, be aware that, if you are feeling tingling and numbness, maybe you do some stretches and some recovery strategies to help improve blood flow back to the tissues after a prolonged time of compression on those nerves. And like I said, they get cranky, but they're totally treatable. And the sooner that you can talk about the issues going down in your pants, the better.
That's awesome.
All right. That was my disclaimer.
Yeah.
Cool. So awesome. So Danny, tell us about other patient cases, particularly with ED. I would love to hear experiences.
Oh yeah. So I had one that was, he fractured his penis. Didn't tell me how.
Tell us. Oh, he didn't tell you how. Okay.
Yeah. He's 36 years old and he had to go to the ER, and what he described to me was a botched job surgery. So I'm only assuming that nerves were severed. So when he first called me, I was honest. And I do this, by the way, with every patient. I say, I don't know if this is going to work for you. Okay. But we're going to try it and I'll do what I know is best. And, if it, we'll just see what happens. So anyway, he came, I think he started twice a week. Mm-hmm. And then we tapered off, but it was 10 treatments and he was back to 100%. And by the way, I don't hear back from these guys. It's so funny. Like I just had a couple people come back to me after 3 years. So I'm assuming, and the reports have always been that they didn't have any problems in that time of their way. So yeah, it sticks, I guess. Yeah.
Oh, that's amazing.
Yeah, it was cool.
Cool beans. Yeah. Oh my gosh. And yes, fracturing the penis, it sounds scary, but there's no there's no bone in your penis. It's there's a lot of ligaments that suspend the penis. And sometimes often it's with like a sexcapade gone wrong or something. There is an audible pop, or there can be, but that can happen to any part of our body that has a tendon that attaches to bone or muscle. If you strain it or sprain it, that ligament. So that does happen. And yes, sometimes surgical intervention is necessary, but it also heals on its own as well. I'm sure it's not a very pleasant experience, needless to say.
Mm-hmm. I can only imagine.
Yeah.
Yeah, but I've had a few other, most recently it's been anxiety and emotional. Like you mentioned that, the mental emotional part. And in your bio, or when you introduced me, you said the neuroemotional technique, which is NET, if anybody else knows about that. And that is based off Chinese medicine. And so sometimes there is stuff that's happening that's mental, emotional. And in this case, this person is in their 30s. Mm-hmm. And I asked about stress, and he said, on a scale of 1 to 10, I ask everyone, where are you in stress? And he said, I'm about a 1 out of 10, but when it comes to my erection, I'm about 9 out of 10. And I said, oh, interesting. So he thinks about it all the time and sexually active with his partner 4 to 5 times a week. And the whole story and inner critic is going on in his head of, is this going to work or not? Right. So that's hard. And that, no point intended, that will definitely affect things going on down there, because our brains are so powerful, right? And so in Chinese medicine, this system that I learned, which by the way, I don't try anything in my practice unless I've tried it myself, but all the meridians are connected on the brain. So you're integrating 3 things: muscle testing, activating the acupressure point on the torso by me touching that point, muscle testing, and then what we call verbal semantics. And so generally in life, there's 2 things that are stressful: money and love. And so we go through, where is it attached? And one thing, important factor I did not mention was that every meridian is connected to an organ, and it's also connected to an emotion, and it's connected to an element. So for instance, the liver channel is, the element is wood. It's partnered with the gallbladder. So then yin yang, if you remember that Tai Chi symbol, the black and white, that's perfect harmony. And so nobody is in perfect harmony. You have to have equal amounts of both. So we're checking, and the emotion with liver is anger. So long-stemmed anger. And what we do is by integrating all 3 modalities, muscle testing, verbal semantics, and activating the acupressure point, we bypass all three brains and we go into the amygdala. So that's where the memory is stored. And the three brains would be fight or flight, logistical neocortex, which is reasoning and thinking, and then your emotional brain. So you don't have time to think about it. And we're actually just kind of bypassing that. And we're going right into that original event. Maybe it's a childhood thing that you've actually just lived your whole life in different patterns. And we clear that with acupuncture. And that is a big shift. So sometimes that happens. I have had a couple cases where I'm like, they try to treat me like I'm the counselor now, and I'm not licensed as a counselor. Right. So I say, why don't we try this? And that usually creates a shift for them. Right. And then the other thing is that acupuncture, there's a protocol in the ear that I do that helps with anxiety and depression. And so once that's usually the first thing that goes away, is that they feel more calm in their body. They can sleep better. And then it dives deeper. Then the blood and the chi and everything can start going. But your brain's also going to control that.
Right. Right. It needs to feel safe. I mean, there has to be a sense of safety for all those processes that are regulated by those, the rest and digest, quote unquote, functions, right? Yeah. The nervous system and then the neural networks of our brain. And memories are stored, never forgotten. Sometimes they are, but they're always there, and anything can kind of trigger that. And so I'm glad that you brought that up, that whole emotional connection and the physiological responses and protective responses that can happen in our body. And that can dampen and put the brakes on lots of things, right? Exactly. All organ systems, including erectile tissue. So absolutely. Yeah. Because you mentioned the penile fracture, there's a book called Broken Banana, Life, Love, and Sex Without a Penis. And it's written by Ross, I hope I don't butcher his last name, but Asdourian, Asdourian. It is hilarious. He's a comedian, but he actually tells a story about penile fracture and what he went through. So if anybody's listening or watching, I highly recommend it. Check it out.
That's cool.
Support, you're not the only one that goes through this. There's so many people that have experienced issues down below. And this is one way of expressing his, reaching out, telling people about it. So
that's great.
Cool. Well, awesome. So Danny, how can listeners get in touch with you? Can you talk a little bit about your 90-day men's membership program?
Sure. Yeah. I'll just, so I also want to talk a little bit about my clinic. So I have a clinic here in Portland, Oregon, and we have a chiropractor, a naturopath, another acupuncturist, massage therapy. And so we're kind of an integrative clinic. And what I've wanted to do is run that, so really create a place where all practitioners are super happy to work in a place that's dynamic and we all have the same vision. And then what I decided was these two patients that came back after 3 years, they actually asked me, hey, can we just prepay you? And I said, I guess so. So I was thinking about that, like, what would that look like? And I talked to a couple doctors. I work with some urologists and whatnot, and formulating how this would look. Mm-hmm. And so the 90-day men's membership is simply you buy 10 treatments and you get 2 free. And so each treatment's $150, and the commitment is 90 days. So the whole package is $1,500, and they're seeing me weekly. They're getting an hour of my attention every week, and they're able to relax. Most of the time they're sleeping. These hair-like needles are it's like putting a piece of hair in your body. And a lot of times I hear snoring as I leave the room. So it's nice.
It's a good sign.
A lot of my patients say it's their one time to rest and relax and get their nap in. And then the side effects are amazing, right? Because they're getting a hard on.
Well, a hard on and all those other collateral benefits that you mentioned, like relaxation. Yeah. And earlier you mentioned sleeping better.
Yeah. And also I think some people do wonder about this is, will I get an erection during the treatment? I've only had that happen with one time with one patient, and he was actually quite embarrassed, and obviously he didn't have a problem. So he didn't come back, which was fine. But no, that doesn't really happen. It's, sometimes people report the next morning, the best night of their sleep and a morning erection. And then quality and strength is always what we're talking about. What's the quality and strength of your penis? Right. And where would you say you are today? And gradually it's growing, literally growing. I learned that on your show too, that the length of the penis is inside, right? Oh
yes,
God.
Some are showers, some are growers.
Yeah, I tell my patients that and they're like, get out. That's not true. I'm like, yeah, if you're
Yes.
6 inches on the outside, you're also 6 inches on the inside. Something like that, right?
Well, a lot of it, well, again, some are well, again, showers. So what you see is what you get.
That's right.
Just kind of pops up. But others are growers where, yes, you might look smaller on the outside, but when you have an erection, it's like, blowing up a balloon essentially. And yeah. And again, everyone's size is so different and there's no norm. It's impossible to measure every single man's erect penis on this entire planet. So, what you have is awesome. So just use it.
That's right.
Or get help for it if you can't use it. And so yeah, it's funny.
Yeah.
Cool. All right. And I'll definitely link. So for everyone listening and we're watching, I'll have the Daniel's clinic website linked to the show notes and the 90-day membership and all the information from there. Is there anything else that you'd like to share, Danny?
Yeah, I just want to thank you again. And just to clarify about my website. So it is the clinic website. If you go under health issues, you'll see erectile dysfunction and go to that page. And then that talks about the 90-day men's membership. But yeah, I can be reached in Portland at 503-206-0300. And we'd be happy to help you out. I also offer free 20-minute phone consults.
That's nice.
So, yeah, I think it's important. And I've actually had people show up at my front door thinking it's in person, and that's fine too. But sometimes I'm doing it in between patients. So, we'd be happy to help you out and answer any questions.
Oh, well, thank you so much for helping to support men's health and really, again, just taking this revolutionary step from an acupuncture standpoint. Like, again, I've not really heard an acupuncturist really catering and specializing in supporting men in this way. So kudos to you. Thank you.
Yeah.
And to all our listeners out there. And also, again, Danny, thank you so much. I apologize for not thanking you. Thank you for being on the show. Thank you. Appreciate it. But yes, to all our listeners, I thank you as well. Thank you for following. Thank you for watching. Thank you for supporting. And as always, in loving wellness, we're your pelvis. Until next time, my friends, we'll check you later. Bye.
Dr. Susie, thank you. I'm so grateful as well. Thank you for the opportunity. Yay.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear feedback. Thanks again.
No pun intended.